So good morning, everyone. And today we are live for the 65th Roundtable Expert Group meeting. Today's we have a topic of Delta plus variant and third wave. And it will be presented by Dr. Shashank Joshi, who is an endocrinologist from India. Over to you, Dr. Shashank Joshi.
So thank you, Saurabh. Good morning, everybody. We are between waves in India. So are my slides visible, Saurabh?
Yes, it is. Yes.
So we are between waves in India. So what I'm going to initially give you a prelude is discuss something from, as we in north of India, we have seen that the second wave is almost over. And I'm going to talk about the potential of the third wave. So now that we are between the waves, as they would call it, we know that, the whole philosophy of the stages of COVID pandemic has emerged very fast. And we all know that the structure of the coronavirus is now better encapsulated. And we also know that each of the structural proteins we understand better, because to understand the Delta variant, to understand the third wave, we all now know that the spike protein is crucial for receptor binding. The membrane protein is essential for viral assembly. The nucleocapsid protein is very important for the RNA synthesis and is also interacting with the M protein during the virus bedding. The E protein is a very small envelope protein. It is important to have the function, but it's still not fully understood. And then, of course, we have the HE, which is the hemagglutinin esterase glycoprotein of the beta coronaviruses, which doctor from Singapore is alluding to, whether it uptakes on the mucosal cells. We also know that the SARS-CoV-2 binds to the human ACE2 receptors. And we know that the type 2 alveolar cells have the highest concentration of the ACE2 receptors, followed by bronchial epithelial, tongue, buccal epithelium, upper intestinal epithelium, myocardial cells, kidney proximal tubular cells, bladder urothelial cells. Even now we have data to show that this could be binding to even the pancreatic beta cells. And we know that the SARS-CoV-2 has a 10 to 20 times more strong bonding than other SARS viruses. We also know that there is something called as antibody-dependent enhancement, which means antibodies can create a backdoor entry for viral replications, and this can be looked at. So when it looks at the Delta variant, you see this is predominantly the 617.2 variant, which is predominantly seen as a variant in the spike protein, which is predominantly from the Indian geography. But now we know that a large proportion of the geography in the UK and in the US also comes from the Delta variant. We know that SARS-CoV-2 had different routes of transmission. We had the large droplet, the medium droplet, the small droplets. We also know that the droplet-borne route, the short airborne route, the long airborne route was all predominantly through the aerosols. We now know the fomite route is less responsible. So if you look at the first two waves from India, you can see that the R0 was 1.37 as of April 2021. And you can see clearly that the second wave was having a geometric spike. And we know that if we have to go into a prediction model, the wave could have continued much longer, as long as October, but suddenly it has waned away. So we don't know the reasons why it has gone. In fact, we clearly know that the first wave and the second wave, there are higher peak and a very, very sharp and a precipitous decline. So this is something which we know that whatever modeling was done, the wave went away very fast. So, we have just finished June. We are only on the 3rd of July. You can see that suddenly it went up and suddenly it came down. So we really are trying to analyze the reasons. So if you see the incidence of the first and the second wave and the exponential fit of the first and the second wave, there is a difference between the two. And you can clearly see that the second wave trajectory is very, very different from the first wave trajectory. And that was predominantly driven by the Delta variant. We also know that we have now almost 34 crores vaccinated, and that's a very, very good number. Now, this is the Maharashtra data. Again, you can see Maharashtra, the second wave really took off very aggressively. And probably the models had predicted it, but they had predicted it earlier, and they had not predicted the rationale of it. We also know that the geographic distribution was different, and we also know that the symptoms were different, and we also know that the new symptoms watch in the second wave, which was the Delta symptoms, now they popularly call it, were nausea, abdominal pain, hearing impairment, vomiting, diarrhea, GI disease, joint pain, weakness, loss of appetite, conjunctivitis, skin rash, discoloration of fingers and toes. And so therefore, there was some differences between first wave and second wave. First wave was dry cough, joint pain, headache. Hospital admissions between first and second wave was similar. People under 30 were similar. Average age was similar. Mortality again was similar, but in different geographies it was different. The cases, of course, were almost multifold higher in second wave. The actual numerical mortality was higher, and we know that the peak was abrupt. The first wave peak was September, second wave peak was April. And we know all these viral phases and all. So I'll stop sharing my slides. So what emerged in the second wave is, and we are still in the second wave. If you ask me, even today, we are reporting 40,000 cases from the country. Of these 40,000, 10,000 are coming from Maharashtra, 10,000 are coming from Kerala, and rest of the 20,000 are coming from northeast of India, Bengal, Orissa, Telangana and Andhra Pradesh, Tamil Nadu, so south of India. From the north of India, predominantly the wave has gone. If you see Delhi, which tests more than 70, 80,000 cases per test per day, they are now in single digit and double digit. So virtually from Delhi, the coronavirus or the second wave has gone. While we are seeing that there is a thick tail which is still existing in a lot of geographies in India. So the three strains which emerged from genomic sequencing, which led predominantly to the second wave, were 617.1, which is now called as the Kappa variant of concern, 617.2, which is now called as the Delta variant, and 617.3. You also know that in Delhi, Haryana, and Punjab, the mortality was higher because Alpha variant was still there. So that is something which was there. Now, concerns came out that there is a Delta plus variant, and the Delta plus variant is something which is now being recognized and has been red flagged. Originally, Delta plus variant is AY1, and this AY1 Delta plus variant had a mutation K417N. This originally was seen in the gamma, or the, sorry, not the gamma, the beta, which is the South African strain. So the beta strain had this 417 mutation, but this was unusually noticed in AY1. And this was predominantly seen, this so-called Delta plus variant ka mutation was predominantly seen in United Kingdom and Nepal. And then there was genomic sequencing analysis done by various laboratories through ENSACOG, which include the Institute for Genomics and Integrative Biology from New Delhi, Faridabad, also from the CSIR labs from NCCS, NIV from Pune, and all these genomic sequences labs in India documented around 41 cases of Delta plus. So the first Delta plus which came out, AY1, was in UK. What they found in UK was that this was more transmissible, similar to Delta. It had a tighter binding to the ACE2 receptor, and it escaped the monoclonal antibody, and it could cause immune escape. So these were the three features of the Delta plus. But in India, we found approximately 41 cases, and the genomic sequencing is still ongoing. Of the 41 cases which were found, there were 2 deaths. One was a patient from Rishinagar in Ujjain, and second was a patient from Ratnagiri. The patient in Ujjain was not vaccinated. The patient in Ratnagiri was above 80 years with comorbidities. So naturally, most people, their genomic samples were taken end of May, and they have survived for more than 2 to 4 weeks with mild to moderate disease. And it does not appear like the UK or the Nepal variant to be sinister in nature. There was also a suggestion which was felt because more than 20 cases were in the districts of concern of Ratnagiri, Sindhudurg, and Raigad, which is the mango belt from Maharashtra. You know that when the mangoes are plucked out as fruits, normally people from Nepal come to pluck the mangoes. And prior to documentation of Delta plus in India, Delta plus was originally seen in United Kingdom, the AY1, and in Nepal. So there was a suspicion raised by public health scientists, including myself on the task force, that could it be that people who came in February, March to pluck the mangoes from Nepal to Maharashtra in these three geographies, were they responsible for getting this strain to migrate? Because there was a geographical movement. But the genomic strains done from Nepal were also done by IGIG, which is the Dr. Anurag Agrawal's lab in IGIB in Faridabad. They only do it. And they found there was no connection between the AY1 found in Nepal and the AY1 found in Ratnagiri, where the mango plantations are. So there was no link between the two. But one thing is sure, that it is a delta. Because it is a delta, the R naught is more. We all know delta is cluster spreading. Faster spreading, faster recovering with low case fatality rate. And the delta plus also is probably faster spreading, but not as fast as the delta is the early observation. The data is too less to make any recommendation. And also we do not know whether the faster spreading or the faster recovering delta, the delta plus had similar features. Also, we did not see the titer binding to the ACE2 protein, but obviously all these areas were micro-contained. They were flagged off as districts of concern. And because they were micro-contained, we hope that the delta plus is eliminated. So delta plus may not be really truly delta plus. It could also be delta minus. But delta has been a source of concern. Why is delta a source of concern? Three reasons. Number one, it is rapidly transmissible. So it's a cluster spreading rapidly transmissible strain. No question asked about that. Number two, it may be faster recovering. The virulence is unknown. Some people feel that it causes more hospitalizations, but that data is still not straightforward and clear cut. But that's something which has been postulated. And third is delta may have an immune escape, mainly to Covishield. So there has been a concern, but the data published from CMC Vellore, data published from various other corporate hospitals like Apollo and Fortis, people who have received 1 or 2 vaccines and who got a breakthrough infection with Covishield, most of them had mild to moderate infections and very few had severe infections or deaths. So that is very reassuring. So currently we know that there is delta, which is predominantly replacing the old strain. In city like Mumbai, we have a thick tail. So we still have a little bit of kappa left there, which is 617.1, which is a variant of concern or a variant of interest, or not variant of concern. And so it's delta, a little bit of kappa left, a little bit of alpha still left in north of India, predominantly in the Punjab region. And beyond that, more or less, delta has become the predominant strain now in India. And probably is becoming the predominant strain across the world. And clearly the wave is on the decline. Now the challenge is, and as we unlock, there are 3 yardsticks. Number one, keep our TPR by RT-PCR below 5% for 2 weeks. Try to saturate 70% of our population with vaccination and have zero tolerance for COVID appropriate behavior and COVID appropriate protocols. If these 3 criteria are fit, then we can unlock. Unfortunately, we know unlocking happened too fast. And now there are restrictions in place. And because the second wave is not abating in different parts of the country because of a little rapid unlocking, we are seeing that what is happening there and what needs to be done. So obviously we know that there is a challenge which we have, and we also know that there is going to be a problem which we have because the second wave may go into the third wave. Mathematical models up till now, whichever predicted first wave, second wave, they all have went wrong. We knew that there is a third wave coming. Prediction by most models, whether they are from India or outside India, for third wave in India is somewhere down September to November, we'll get the third wave. And this wave will be less if we are able to vaccinate more. So we all know from all experiences all over the world that the earlier you vaccinate, the lesser is going to be the intensity of the next wave. We know Hong Kong is in its 4th wave. We know that Singapore has already vaccinated a large proportion of its population with vaccines. So the only way that there could be an outbreak now is either an immune escape or it could be the lack of adherence to COVID appropriate protocols of behavior. And therefore, 2-3 things which we need to clearly follow. Ensure that we double mask whenever we are outside or we are in human contact with someone else. Number 2, try to get your both vaccine shots as early as possible. And if you have already finished your 2 shots, maybe 3-6 months back, check your antibody status for neutralizing antibodies and get your booster done. And the third thing is focus on air ventilation. Try to see that avoid crowded spaces, poorly ventilated spaces. And if you're living in an environment, try to have an air ventilation unit, which means that you ensure that there is HEPA filter or a simple exhaust fan so that there is circulating air so that we are able to prevent the infection. So those are the keys. So as far as India is concerned, we predict that the third wave may come faster and there may not be any gap between the second and the third wave if we are not following some basic norms of COVID appropriate protocols. Currently, the worry is that the second wave graph is not coming down as anticipated. The rapidity at which it came down in some parts of particularly North India is extremely impressive, but has not been seen in some other parts where there is a thicker tail. And it appears also that geographies of Maharashtra and Kerala are becoming endemic, and therefore Corona may stay there. So we'll need to keep up ramping our testing, tracking, and treating strategies in a more aggressive way. And we'll have to continue our public health measures. So that's where I'll stop. So we still have the Delta variant. Delta plus is a cause of concern, but current early data indicates that it is not as sinister as has been projected from United Kingdom. And number 3 is that we know that we may get an anticipated muted third wave in times to come. So that's where I'll stop, that we have Delta. Delta plus may be a little bit of similar to Delta. And we also know that we have a third wave, which is looming large. But currently the need of the hour is aggressive vaccination, double masking and following of COVID appropriate protocols. And the third thing which we need to very, very clearly do is have better ventilated environments. So I think I'll stop here. I just saw Dr. Sunila Garg has just joined us. We can probably ask her what is her prediction, because she's also doing a lot of modeling. What is her prediction for the third wave? And what does she feel about the Delta and Delta plus?
Before that, the person from Singapore, have we answered your question? The doctor from Singapore?
Yes, fantastic. We were just very curious about Delta Plus, because initially, like we were worried that it's going to be a lot more virulent and may have a high mortality rate. But from what you just spoken, it may be only as bad as Delta, so we may not have a new, a sinister monster coming out, and that's very reassuring. Thank you so much, sir.
Thank you.
Before we go to Sunila, Dr. Joshi,
Yeah.
I have one observation which I would like to put it to you as well as to Sunila and all my colleagues. Thank you, Dr. Joshi, for giving a very important information regarding the subject for today. And there are a couple of observations from my side also. Wave 2. Wave 2, where if I am trying to recollect, Sunila may correct me, per day maximum number of cases in India went up to somewhere around 400,000 plus, right? And today we are talking in various days somewhere 46,000, 45,000. And I was trying to look into the geographical detail. And you correctly said, Dr. Joshi, that these geographical details are confined to certain states. I'm so happy that Delhi is hardly in 2 digits. So is UP, so is Punjab, etc. But of course, Maharashtra in continuation, there is some continuation of Maharashtra to Karnataka. There is some continuation of Karnataka to Kerala. There is, I'm trying to link the geographical areas. And if I try, and Tamil Nadu, okay. So if I try to link a little bit, practically all the states of down south, below Maharashtra, The same is true little bit in Telangana and Andhra also. But then we go to Northeast. Northeast is Assam and that area. So in India, there are two separate pockets. Sunila, what I'm observing, that this pocket of, say, Western South India, as well as the Northeast in India, and where still the out of 45, 46,000, I like to say approximately 90% cases are there out of 45, 46,000, and rest are shared between various states of India. This is my one observation. And perhaps as epidemiologist and public health, both of you are the perfect person to give me some solution to that. I think second question I'll put later. Sunila.
Good morning, everyone. Thank you, sir, and thank you, Dr. Joshi. Basically, what I wanted to say was that in continuation with what Dr. Agarwal has said, that we have got 5 states today which, who are contributing to 36% of our new cases, and out of which, Kerala is contributing to maximum. And center has rushed the investigating teams to those states, and the states are in, northeastern region, Kerala, Odisha, and all that. So that is there. But then again, as Dr. Joshi pointed out, that we need to look at exactly how, we are unlocking now. That will have a lot of implications on whether we talk of third wave. So that is one thing which is very, very important. So then also we will have to look at that how much is our susceptible pool. Though by and large, our sero surveys are showing that, around 60% to 70%, seroconversion, but then how it behaves after 6 to 7 months, that is another thing which is important. The second thing which will also depend upon the COVID appropriate behavior, which was appropriately mentioned by Dr. Joshi, that how much percentage of our population is following that, because you see earlier also we had discussed that it's only about 50% of our people are wearing masks, and out of this only 15% are wearing it correctly. So we have to take, when we do the modeling, so we have to take all this into assumption, and how much will be there. So how much percentage of population will be immunized, that will be there. And also we need to look at our efficacy of the vaccine. So we have to look at that whether we are working with the effective vaccination or not. So that will decide. But we have to first see that how we manage this second wave. And so that will be one of the most important things, because today only when it came out that, we are talking of the third wave, but as of now, you see, second wave is still, not gone out of particularly these 5 states which are contributing to majority of the cases. Like 11,000 approximately cases are coming from Kerala itself. So we need to look at that part very, very correctly. And then over a period of time, then we see that we have some assumptions which will be dependent, and basically they depend on 2 things. One is the COVID appropriate behavior, and the second is the immunization coverage. Ultimately, they will decide about our susceptible pool of population. If our susceptible pool of population is large, though by and large, as I told you, that should be less, because we have got huge, seroconversion in terms of, our sero surveys have shown. But as far as the children are concerned, in wave 1 and wave 2, we did not see much of difference, because, under 10 years of age, we have got 3% of children who were immunized. Until 20 years of age, if we say around 10% of children in wave 1 and wave 2 both were, affected. But what is important is that what we saw was, multi-system inflammatory syndrome in children, which was after, they suffered from COVID. So that became an important problem, but that is also declining now. So we have to see that, to my mind, I feel that since now we have got a huge chunk of population which has been, kind of, infected, as demonstrated by sero survey. If we talk of October to November, because from August onwards or July middle, I'll say, we will start doing vaccination in big numbers. So even if we immunize about 20 crore people in a month, so though ministry has mentioned about 1 crore persons per day, but I even look at it as 20 crore, because right now we have gone, quite high, because our susceptible, people who were to be immunized above 18 years of age were 80 crore people into 2. That means 160 crore people we have to immunize. And if we are looking at 34 crore, which have already been done, so we are remaining with approximately about, 126 crore or something like that. And then if we see that in 6 months we are able to immunize that much chunk, so this will cover, quite a bit. But, substantial proportion will also be contributed to people who have already been infected. So that is where I think we should be able to say that second wave is not going to be that serious in nature. Number two is that our system preparedness is going to be there in terms of capacity building, in terms of availability of beds and all that. And we will have, trained manpower also, because focus is being made primarily to, acquaint our people with regard to management of children as well. Indian Academy of Pediatrics also is working quite hard in this direction. And also the preparation of beds, particularly for children, are being taken care of. And now as far as oxygen related thing is concerned, we are quite comfortable, and the districts are coming out with the oxygen plants depending upon the population of the districts. So I feel that the third wave is not going to be as much, ferocious as we saw in the second distinct. This is as of now, but we have to closely monitor our genetic mutations. And between Delta and Delta plus, we have not seen many cases of Delta plus as of now. So what is important is that in UK, whatever problem is happening, that's only because of the Delta strain. So I feel that, and even we need to watch that in Kerala as well. So genomic sequencing becomes an important part of our, exercise which we need to do, and we need to be more transparent in displaying the data on our, and sharing the data with between the ICMR and ministry and all with the researchers, so that we can predict that also. So that is another thing. So as of now, Delta plus does not seem to be one of the, though it was earlier when it came, everybody was worried about that. But then looking at the number of cases, we don't feel that Delta plus is going to contribute to larger number of cases in terms of more severity infection. Thank you, sir.
Dr. Sunila, can I ask one thing?
Yes.
Madam, and the question to Dr. Sunila and Dr. Shashank both, you both are talking about how effective is vaccination. That is a very, very good part. Until unless we are not concentrating on the vaccination, it will be very difficult for us to combat the third wave. But one theory, I have got one family in which 3 persons got vaccinated, that is Covaxin, and all the 3 got their antibodies tested, 0 antibodies in all the 3. And 2 more my patients came, they also told me the same thing, their antibodies is 0. Now I don't have any answer to reply them. What is your opinion? What I should give to them? 5 persons approaching me and all 5 with 0. They all are my patient. I don't have any answer, because at least some antibodies should have been there. And if it is coming 0, whether they will be effective or whether they should go for another vaccination of the Covishield or Sputnik or whichever is available, or they can rely only on the Covaxin, even if the antibodies are not formed. So please guide us.
Dr. Joshi, will you like to take up this? So till that time, I will also say that, basically it also depends upon the efficacy of the vaccine also, because no vaccine is having 100% efficacy. And that's why we are also having, Dr. we are having breakthrough infections as well. So we also conducted one study amongst healthcare workers, and even Apollo hospitals have conducted. But in our study, what we found, that persons who had received 1 dose of vaccination, amongst them, the reinfection was to the tune of, or infection was to the tune of 20%. But the persons who had, both the rounds of vaccination, in them, it was about 9%. So that article has been just published also. So what I can say is, it a lot depends upon the efficacy of the vaccine. Maybe they fall, it could be a chance phenomena that all 5 of them could fall to in that category, that, where the seroconversion was not there. So we have to say only this part as of now. But by and large, you see, when we talk of, we require only 60% of the efficacy as far as Indian setting is concerned. And both of these vaccines are having above 60% efficacy. And as was compared in this Public Health England study also, that when they gave 1 dose of AstraZeneca vaccine versus 1 dose of Pfizer vaccine, both were effective only in 30% of the cases. And there they looked at Delta variant specifically. And then, when 2 doses were given, AstraZeneca was effective in 60% and the Pfizer vaccine was effective in 90% of the cases. So this is how one comments on this. And primarily, I feel that we need to look at that vaccines are definitely effective in preventing the, moderate infections and also hospitalization. That is one thing which we have to say. But as far as, but the studies during the trial also, took into consideration the efficacy definitely talks about that 60 to 70% of the cases are not going to get the infection. That is important.
I think I would like to pitch in, Dr. Rai.
Yeah, Dr.
Can
Nita.
I contribute to this, Sunila?
Yeah, definitely, Dr. Nita.
Yes.
Anita, before that, I'll just give one comment.
Sure.
It's a matter of chance. Dr. Rai mentioned about 2 of the families. As Sunila said, it's a matter of chance. If I try to think about my personal experience, I would like to say that yes.
Am I clear?
Anita?
Can I be heard? Yeah.
Anita, can you hear me?
Yeah, I can hear now.
Just give me 1 minute and then please take over. Okay? So most of my personal acquaintance has got very good response to this particular vaccine. So I like to say it is like if we predict that the success rate is going to be 80 plus, 85 plus, so maybe that those 2 families went into those 15% cases. Otherwise, there is a wonderful response.
Yes.
Dr.
Agarwal, I fully agree, and as a doctor, even I have replied that way. But the question is, both families are 3 families. I mean, in one family, 3 persons, and in 2 families, one person. And they are asking, sir, should we go for another round of the vaccination of the Covishield?
Let us hear Anita now. I think she may give us the answer.
Okay.
Anita?
Anita can't hear you.
Therefore, it is not necessary that 2 members are not getting because the efficacy of the vaccine is not there. It is both the host response as well as the vaccine given. And it also is related to age also. So it is not only you're doing IgG and finding out how much antibody is there. One has to see how much the neutralizing antibody is there, what is the protective antibody. So there are many things coming into play. Many of us who have got vaccinated, we had breakthrough infection. The only thing is that you get mild.
Now, if I remember Dr. K.K. Agarwal, our friend, he got both the vaccination, and even he told us in the roundtable conference that his immunity antibodies are 0. Now they are the person, and they have heard them also. Now they are so intelligent person. They are asking me only one question, sir, should we go for another? And if there is 0 antibodies, what is the result of whether I will be getting again infected or not, whether I'm protected or not? That is the problem which as a general physician, I have to tell them.
Dr. Rai, your question is very valid. And this is also, discussed in National Technical Advisory Group where Dr. Arora is leading that group. So he also mentioned that, they're also thinking in terms of, over a period of time, whether we'll be needing a booster. Another thing is whether we'll be mixing 2 vaccines. That is also, that means we take 1 dose of Covishield or another dose of Moderna, because now we will have a lot of vaccines in our kitty over a period of time. So that the time will tell over a period of time, as Dr. Nita said, but we need to look at the whole profile of antibodies. But I'm sure that, whenever, if God forbid they get the infection, that will be of much milder this thing in nature. That's what I feel that. But then most important is COVID appropriate behavior, what we recommend to them, that even after vaccination, you just follow that. So there are a lot of questions which will come over a period of time, and everybody is having a lot of puzzles also. Like yesterday, many women called, about the pregnant women. Should we go for the vaccination? Now government has said, but we only have got our, results from Moderna vaccine, which have been given to large number of pregnant women. We have no experience about Covishield or Covaxin. We presume that they will be safe, but then as scientific people, we feel that, we should have the data based on trials also. Thank you. Thank you, sir.
Neela, what I feel is, what I want to add is, idea behind vaccination is that you don't want the virus to remain in the body for too long, mutate. One of the reasons why the virus is mutating is because it's happily staying in a human body, and it is adapting, it's mutating, so that the antibodies generated by the host, they are not neutralizing the new mutated virus. That's why you're having the escape phenomenon. So vaccination, whatever vaccine one is giving, go ahead, just push the vaccines. Booster, yes, booster will claim, that is the prediction. They are doing trials. There was Pfizer, yes, they are going to have some boosters. But regarding AstraZeneca, we'll come to know soon, so we cannot jump. But yes, as Dr. Rai said, there are many people who are worried, are they immunized properly because of the breakthrough? But now just stop the mutants by immunizing everyone. Delta variant, we know, is not causing very much infection now. Not much is known, it's being worked out. And we have a very good INSA-GOG system, with MAMC also coming into the play for sequencing. So these data are going 4 times a month to the health ministry. Everyone is analyzing. We are coming to know which is the new mutant. Stop, restrict the flights from there, or make more stringent measures of testing so that they are not transferred. We know there's Lambda mutant outside India. Yes. It has not come to India. Now we should try not to have the Lambda mutant in India. So there are, all these things are an interplay of people's restriction. That is what has to be there. That is very, very important. Travel is one of the most important things by which these mutants are even getting transferred. So this is all that I wanted to add, actually.
Thank you, Adita, for very useful inputs. Thank you. Now, who is going to talk? Is Saurabh there? Who is?
Yeah, I'm there. I'm there.
Yeah, who's going to talk now? Saurabh, you can.
So Dr. Shashank is there. Also, I have one question which was there in the chat box. I'm not sure. Is there a difference between the Delta and a Delta plus variant in terms of the spreading of the virus? Like how different are both the viruses in terms of the spread?
Anita, will you take up this question?
Delta plus has not come to Delhi, and we really don't know why it hasn't come to Delhi. But and Delta plus is more of a, it's a lineage variant. So the lineages form the strains. So there has been some mutations in the basic Delta virus, and therefore this 2 types of lineages have come out, like Dr. Joshi said. So it would, why not? It could spread. People are working on it. They don't know whether the transmissibility is as high as the Delta variant of Delta plus, but at present it looks as if it is not, seeing the RO levels and all that. But it's difficult to say. It will take some time.
Okay, thank you so much. Okay, and
Dr. Alex, I have a question for you. You had, I think your organization has talked about importing some more vaccines, no, for immunization along with. So I was reading in paper yesterday. That is it.
Yeah, no, actually, thank you, Sunila. We actually got into the picture some months ago and we were pushing vaccination. And then there was a time when the smaller hospitals were not getting vaccines, only the big chains. So that's when we intervened. We actually contacted the companies, but they were keeping on fobbing us from one excuse or the other. So then we had to actually say that this is not right. We wrote to the health ministry. And as we were starting to get, you see, they were not willing to give small quantities for the smaller hospitals. Finally, we were able to talk to them and convince them. And as they started doing this, the health ministry passes order that it has to come through the government. And we also push for it because in this new policy, the government will distribute to the private based on the requirements, so including the smaller hospitals. So it's been a sort of victory in one sense, but I hope there are no sort of hurdles to this because that is the need of the hour is vaccination, as all of you experts have been saying. On the other front, that is the non-COVID, non-Covishield, we actually have been talking to Sputnik. They promised us they were supposed to give it to us 3-4 weeks ago. It still hasn't come. And now we are talking to J&J. They said that they would give it to us in the next couple of weeks. But till it comes, we can't be sure. Good thing is many of our hospitals in the Northeast, smaller hospitals, were able to get Covishield because of earlier efforts. The other thing that we were concerned, and of course you will be able to tell us, is if you look at the first initial vaccination, 70% was given in the private sector for frontline workers and health workers. So we are really concerned that if now 75% has gone to the government, will they utilize it? So we have offered and said that if the government wants to give those vaccines to the so hospitals, will be happy to do a free vaccination and cap it at 150. Incidentally, that the 150 charge that was put by the government many months ago when we had our internal discussions, we said that you should not be charging more than 150. So ultimately, I think the proof of the pudding is that everybody should be vaccinated, whether it is done by government or private altogether. But I think it's very important that we work together. And a little concerned that over the last few days, the impetus that we've got is coming down.
But I think by July middle, when we get the fresh supplies, and by August we'll be much more comfortable because by our own this thing will come, and then Zycov-D should also come, basically. So we should be looking at, we'll have much more vaccines in our kitty by that time.
Okay.
So, and when we were talking to Niti Aayog, they said the total 1.5 crores by December. So that is how they have calculated in terms of, including Covishield, Covaxin, and all the vaccines which will be there. And a good part is that we are going to get Moderna soon. So that is important, and which will only undergo safety trial on first 100 people. It will not be in the form of, bridge trial. That is there. Thank you for the information.
We should be able to push this faster, Sunila. We are going very slow. Being in the government and an influencer, I think you should push it and going very slowly. Actually, by now, we should have vaccinated the whole country if it started in time.
Actually, basically, it's only the availability of vaccine. That's where it is.
No, there also we could have done something different initially. But anyway, that's what I
absolutely
request you to use your offices for the government
Sure.
I mean, the private sector, and I am sure I will also agree that IMA and HPA, we're all fully with you, and whatever we can do to vaccinate, because India can't go through a third wave. I mean, we have so much of death and destruction and calamity. We must try and avoid the third wave at all costs.
Thank you so much. Definitely. Your point is very, very well. Yeah.
I agree with Dr. Alex totally. And what I personally feel is we talk too much on variant, even in the media, in the layman's circle. What we have to push is vaccine, not the variant. Because anyway, we have to give the vaccine, even if we have a variant, isn't it? We have to stop further mutation. So the concentration should be on pushing the vaccine. And Sunil, you're already taking a lot of lead. Not all the time it's necessary to go on talking about variants. We have a sequencing team there who are sitting, analyzing, So push at the right direction. That should be there. The thrust at the right direction. And I also personally feel, that strict measures have to be taken in closing down all these bazaars which have too many people. Unless we do that, or, make them pay a lot, fines, we are going to have a tough time for another 2 years.
Very right, Dr. Nita. That's what I told them. I said, now we are all kind of, it's a kind of media which is leading the whole this thing about this vaccines and our COVID pandemic. So we need to be, as experts, what I feel, those who come from different angle, one, because you see, it's the media decides what you need to do. That is one thing which is not correct. And, they seem to be much more kind of leading the whole pandemic, which should not be allowed. And there has to be some kind of cuts, that the need of the hour is creating of awareness in the public regarding two things. One is COVID appropriate behavior. Second is, that they should be, coming forward for vaccination. So that is, and third thing is that they go out only when it is necessary. I'm absolutely in agreement with you. There are no two thoughts about it, Anita.
So we have a question for those with 0S serology. Have they tried N serology?
There are different types of antibody testing. So,
0S serology. Okay, please go ahead.
Yeah, go ahead, Dr. Anita, please go ahead. You are the microbiology.
0S serology and N serology is very expensive. Only few labs are doing N serology. I think one test in Lal costs. How many people will go for N serology? I have my doubt. And N serology is caused by.
Very good. Your voice
it's
is
not
interrupted.
cheap.
Your voice is breaking, ma'am. How much it will cost?
Almost 4,000. 4,000.
4,000 to 5,000. Like for example,
Madam, there are the families, they are ready to spend even 4,000, 5,000, 7,000 rupees, because once they have taken 2 vaccinations, they are still in dilemma. Once we are not getting antibodies, whether we will suffer or not, whether we should go for the booster, whether we should go. So any type of test which can confirm that they have got some antibodies and they are protected, they will be satisfied. Today's time, money is not the criteria. As far as the vaccinations are concerned, I fully agree with whatever we have discussed, but still the government policies are not uniform. I'm sorry to say that word. In the Never to Delhi, that is in the Noida, I can name.
Dr. Rai, I think we probably are trying to cover a question. Yeah.
1 minute. Dr. Rai, you are very right. Two things, let me be very clear. One is your antibody question and second is your vaccine question. See, the government has changed their vaccine policy only because their hands are tied because of an erratic supply. So let me be very transparent about it, and whatever is there, they are trying to apply some science on it.
Yes.
I think we all know it. So let's not get that part of it. Let's keep it on the part. Second question, Dr. Anita very rightly said, N serology or neutralizing antibody serology is a costly serology. In Mumbai, we have Bridge Candy, which does virus neutralization test. The gold standard is PNRT, which is very difficult to do and which is only in research lab for vaccine evaluation. Then is, of course, this virus neutralization or N serology, which is around 4,000-5,000 rupees. You are absolutely right that the anti-spike antibody is not correct to evaluate most vaccines, particularly Covaxin. I'm telling you very honestly also on that. Because the immunogenic response or the reactogenic response of Covaxin is not as robust as Covishield. We have only 2 vaccines right now. हम जो evaluate कर रहे हैं 2 ही vaccine है हमारे पास. तो इसलिए इसमें ये ज्यादा दिक्कत आती है. अभी the global recommendations, and Sunila madam is also here, they have recommended antibody testing should not be done in routine practice. So global recommendation, NIH, CDC, they have said कि आप antibody testing करिए नहीं because इससे ज्यादा confusion पैदा होता है. पहले हमने एंटीबॉडी क्यों तैयार किया था नॉन एन सीरोलॉजी का, दैट वाज फॉर प्लाज्मा डोनेशन, कि आज आईजीजी आपके बॉडी में तैयार हुआ है, बिकॉज आईजीजी तैयार हुआ है इसलिए हमको वैक्सीन, हमको डोनेट करना है प्लाज्मा, इसलिए हम कर रहे थे. तो वो था. तो उसमें से क्या था, एक फॉल्स सेंस ऑफ सिक्योरिटी आ रहा था लोगों को, लाइक अ वैक्सीन पासपोर्ट, लाइक अ इम्यून पासपोर्ट, कि हमको हमारे पास थोड़ा सा एक प्रोटेक्शन है. सो दैट वाज द फर्स्ट थिंग. सो दोज आईजीजीज व्हिच आर इवैल्यूएटेड, फर्स्ट व्हिच केम आउट वाज अ ट्रिपल, that is IgM, IgG and IgA. ऐसा एक ट्रिपल 3-in-1 कॉम्बिनेशन टेस्ट था. उसके बाद आया IgG, उसके बाद आया क्वांटिटेटिव IgG. अभी जो टेस्ट आए एंड दे वर ऑल फॉर द RBD और द स्पाइक प्रोटीन. अभी हमारे पास एंटी स्पाइक प्रोटीन एंटीबॉडी आई है जो रॉस वगैरह अच्छी कंपनियों की आई है, एंड डॉक्टर अनीता विल टेल अस आल्सो मोर अबाउट इट. दोज आर रीजनेबली correlated, but these are indirect correlated. These are surrogates, as we in our medical language call surrogates. Now, if you really want to do true neutralization, it is in percent neutralization. So there are also indirect methods and direct methods. Direct method, gold standard is PNRT. where we actually have a live virus and expose the serum to a Petri dish and do that experiment. That is done only in experimental lab, which needs a BSL-3 lab. BSL-3 labs are not routinely available in our country. So then we'll end up doing some of these indirect N serology tests. These are expensive. These cannot be done routinely. In exceptional circumstances, if a particular patient due to anxiety wants to know their degree of protection, it is reasonable. The other challenge, Dr. Rai, is B-cell response is not the only response which we look at antibodies. We also need to understand the T-cell response. Abhi routine practice mein T-cell ke liye there is no test available. Ideally, we should also have a test as a surrogate to understand T-cells. So current concept is something called as hybrid immunity, which means the immunity due to natural infection, immunity due to vaccine, and a combination of both. But right now, whatever we are seeing, कि suppose आपको COVID हुआ है, and उसके बाद आपको एक या दो वैक्सीन लगी है, तो आपको T-cell immunity is 100%, but we can't measure it. But likelihood of protection is high. See, everything is in probability, so likelihood of protection is high. If you did not have COVID, you have taken 2 vaccines, you are unlikely to be protected, or you may have an immune escape. That thing is, we have to tell our patient that आपको, and you may need a booster, but we don't have data. And वहाँ पे mix and match may be better using 2 different platforms. But abhi right now, Government of India doesn't recommend it as a standard of care. So I think let us park this thing, because what you're asking is a very correct question. In exceptional circumstances, Dr. Lal Path Lab या Bridge Candy से आप एक virus neutralization test और N serology test कर सकते हैं. But as Dr. Anita Chakravarti rightly said, these are very expensive. These are not routine standard of care. I have done my own virus neutralization test. So I will give you my results. Okay. I took my first vaccine on 16th of January. After 1.5 months, as a research volunteer, I went to Dr. Aruna Pujari, Chief Microbiologist of Bridge Candy with Dr. Rahul Pandit. We gave our blood. We had 80% neutralization. They give it in percent neutralization, okay, where more than 30% is normal. Then again, after 1 month, we did it. That percent neutralization had come to 40%. So I knew there was a drop in the antibody percentage. I took my second Covishield dose. Then it has gone now to 91% somewhere in mid-April. Now I have not done it. I'm still in clinical work. See, I am today talking on 3rd of July. We are in clinical work. So we are all working in the clinical space. There could be immune response. There could be T-cell response. So we need to understand that despite of all this, if you use double mask with vaccine, it's still going to be okay. My only thing is that this is a early zone area where evidence is not very, very robust and strong. So even after somebody has a neutralizing antibody, I've had patients who have done, who can afford, because like you in Bombay also there are patients who can afford it, and they have done neutralizing antibody. The neutralizing antibody titers were high. They have had 1 COVID, 2 vaccines, and they have again got COVID. Now, how do I explain this patient, Dr. Saab? So I think, let us tell only 2 things, that vaccines are protective. Antibody tests may be misleading. Antibody tests may not be sufficient. Continue wearing the mask, because variants of concerns can trick all this.
Yes.
So that is all we should say. And right now we should continue following COVID appropriate behavioral protocols. I would stop there, because I think, Dr. Saab, this debate and this supply is very erratic.
Very right.
I would like to add that no one knows how long your antibody is going to last. So everyone is working. There are different papers. Therefore, as Dr. Shashank said, I think we have to stop somewhere and just vaccinate and mask ourselves.
That answer we always give, but for our own queries, we are discussing that way. Whatever you have told me, I had told my patient, but I wanted to get myself satisfaction. Okay, let's stop over here. Thank you.
Let me give my comment.
Yes, sir.
Dr. Joshi, I fully agree with you. I fully agree with Sunila, Anita. This COVID is like a whirlpool. We know how it came, but we do not know how it is moving and how much it will move. What is going to be the various? There are certain evidences which are in front of us, and there are many more evidences. It may be something like Titanic iceberg, right? So we have to decide what is best for us. Vaccination is best. Dr. Roy, go for it. Take precautions. As Dr. Joshi said, 1, 2, 3 precautions. And that's all, and keep moving. Keep moving. There is nothing like antibodies, हुए, नहीं हुए, उसमें कोई उसका definite evidence हमारे सामने, अनीता जी, definitely हम नहीं कह सकते कि हम कितने strong हैं. All over the globe.
कौन सी मीटिंग है 2 बजे?
Back to you.
Dr. Sunila?
Yeah. So
Want me, my opinion?
yeah, Anita, your opinion, and then I think we can.
Yeah. We are almost at the close. of the
We
session.
can wind off, but my opinion is that just vaccinate, and Sunila try to increase. Last time I said, and another of my opinion is that maybe the media can go on talking about the essential reason for vaccination more than talking about the variants. That's what personally I feel. And third thing is that, yes, and the third thing is that that these mass gatherings which are occurring everywhere, how does one stop? I just don't know. I mean, I'm at a loss. They are the ones who are going to make us live in this infection for another 4 or 5 years. And we'll be only discussing, that's my gut feeling, you know. Therefore,
Also, I have one question here coming from a non-medical side of it, and staying in a place where it's very congested. So I have a very fear when I go out, and obviously you know that we have lots of people in our family. So when I go out, I have a question as a a doctor forum is what kind of a mask should I wear? If it's a double masking, should I wear both a surgical mask? Should I wear an N95 mask? And what if I touch some, trust me, I move out, people are so close to me, even I can't maintain a 6 foot, that's something which is a dream for me. You know, I stay in Southex, but I have a very
I'm making it very simple for you. Wear a N95 mask, single mask is adequate as long as it is well fitting. Or if you are having a cloth mask, above the cloth mask, wear a 3-ply surgical mask, which is 2 rupees.
Absolutely.
These are the 2 simple solutions for that. The 2 masks give you one advantage कि coverage पूरा हो जाता है. So that is the advantage. तो एक 3-ply mask लगाओ, उसके ऊपर एक cloth mask लगाओ, you are good. And फिर बहुत ज़्यादा सोचो मत. आपने 2 वैक्सीन ले लिए हैं.
Yes.
Okay. The problem is आप जब unmask करोगे ना, that is the only time there is a. So आप जब चाय पीने बैठोगे आपके दोस्त के साथ, तब ट्रांसमिशन हो सकता है. So that is the challenge. ये भीड़ भाड़ में जाने में आपका fear बहुत correct. But try to wear 2 masks if possible. N95 इतना easily मिलता नहीं है, थोड़ा expensive भी है. हम तो use करते हैं because हमारा environment ही healthcare environment है, तो हमको तो use करना ही है. और कभी-कभी on my N95 use sometimes a 3-ply or a cloth mask also.
Okay.
Sometimes we use it because we know that in this zone, when particularly when I'm in patients taking rounds, there is a high possibility of transmission. We know it also. So you see, our zone is different, but your zone, if it's a crowded, congested zone, where there is virtually physical mouth-to-mouth contact, like when you're traveling in a local train in Mumbai, okay, it's impossible that you will not touch somebody or you will not breathe into somebody else's mouth. Okay, so वहाँ पे double masking is definitely useful.
And also, this is one of the most important social vaccines, as I say, because we have huge chunk of population which is still not immunized. So how do we protect them? This is where, we need to follow the COVID appropriate behavior, or, maintain, the sanitization part and all that, because as Dr. Shashank is pointing out, it is very difficult to maintain the distancing part. And now again, yesterday I was seeing that the government has mobilized some police departments to various markets and all, but still they can also have their role very limited unless we have limited number of people who are visiting. Because as I said, the thing which will decide our next wave is also how we unlock and how we maintain the COVID appropriate behavior that is there, because vaccine will come as it is from August onwards. We definitely will have much more supply, but then again a segment of people will still get, it's not 100% get immunized in August. We have to go in a phased manner, but till that time, vaccine is our, mask is our most important social vaccine, and double masking, as has been pointed out by Dr. Shashank. Dr. Alex, will you like to add something to it further with regard to this thing?
No, I think what all of you say is, all of you are experts and totally agree with you. And I'll go one step ahead, and Srila, again, if you can influence the government to make non-masking a criminal offense with a very high fine. They're very reluctant to do that. See, some fear has to be there, no, in our society. It's for the good. So this is something that we have been pushing. Probably, if you can take it up with the government, make it. I believe it is. We spoke to our secretary in Karnataka. He said it's already a criminal offence. But sorry, he said it's sorry. Yeah, so if you can push that, make it a criminal offence and publicize it so that there will be some fear.
Convey to Dr. Niti Aayog as Dr. N.K. Arora particularly, he's looking after the whole thing. So definitely we'll like to definitely. Thank you so much. Anything else?
Ma'am, you're on mute.
That's a wonderful discussion.
Yeah.
I said anything for Dr. Shashank, Dr. Saurabh, what you have to say, and anybody who wants to add to that, we can see.
So I think the only thing which I will add is like the government. So I was going on the road yesterday. I was not wearing a mask, and I was driving alone, and there was a cops who caught me. So there are certain guidelines which government is doing, and there are a lot of action. But I think as a citizen of India, we need to be responsible as well. And I think a lot of things lies on our head. With this note, I would. If we don't have any other speaker, I think we can wind up the session.
Saurabh, I wanted to add.
Do we have any final comments?
Hello, yes, Saurabh. Someone asked, I go for a walk in the park. What type of mask should I wear? What I feel is that if there is no one in the park, actually a mask would not be needed, or one can just wear a cloth mask. Open ventilation is another thing which has to be followed, where you can prevent. But if there are too many people in the park, you have to wear a mask, and a triple layered mask would help, because park is an open setting. It is not a closed unit. So the airflow is there. So the particles will not be static. That is what I wanted to answer. Someone asked, I don't know.
Yeah, I can see the chat comment over there. A very valuable question. A lot of people do ask. Sitting at home in the virtual session, Zoom, people have, they want to go out and walk. But do I need to go out, walk? Can I get an infection? Can I get infection from my parents? Is something. So I was a very, very active person. I have not been doing any workout for over. And, workout at home is very, very sad. It's a very boring thing. So Saurabh, I always prefer to go out and walk.
Saurabh, I will add only one word. Our complacency after the first wave has costed a lot to us. Let's request to the everybody stick to the appropriate COVID protocols, so you will be saved from the third wave. Our complacency is going to cost a lot. Already we have suffered a lot, and we don't want to suffer more. That's all.
Thank you. Any final comments from Dr. Shashank Joshi, Dr. Sunila? Any final?
I think that's all. Follow COVID appropriate behavior and take the vaccination. That is important. These two
very
things
right.
are important.
Thank you.
Everybody has one voice. The single voice is that double mask or die. So, we have to have such very hard hitting slogans. The double mask or die, be ready. And you are asking for it. I think the way people behaving in Mumbai or Delhi, in the malls and outside.
Horrible.
You are almost like inviting the next wave.
Correct.
Yes.
Absolutely. I agree with you, Shashank. Absolutely.
Very sad. This is very depressing. And I think, double mask or die. And the biggest problem is, Sunila madam, you should tell Dr. Arora also that because they feel they are vaccinated, they feel they have got immunity.
Yeah.
What they do,
Yes.
they take a vaccine, they do their antibody test, and then they think, मेरे पास antibody वगैरह कुछ नहीं होने वाला अभी, या मेरे को तो कोरोना होके गया, अभी मेरे को कुछ नहीं होगा. That type of attitude is there. Now they may be only 5% of the population, but these 5% are like spoiled rotten apples, spoiling the whole 95%, and that will destroy us and get multiple waves. And I think, therefore, Dr. Alex's suggestion to have some punitive measure, some criminal measure to curb this inability or have zero tolerance for COVID appropriate protocols and behavior is mandatory. And if it comes from some home department or something, then, it will only be possible. Otherwise, we are actually more or less asking the third wave to enter our houses in a very sad way. And I think if there is a variant of concern and the virus becomes smarter with new mutation, then we'll be doomed, and that is my worry.
Thank you. Dr. Arun, you were
Dr.
trying to say
Sunila,
something?
the last message for you to convey to government, a new slogan, D or D, double mask or die, D or D.
That's also.
So I will take the opportunity to end the session with a note of do or die, a very, very, very valuable thing. COVID appropriate behavior is what is required. Please do not think that you are vaccinated or you have an antibodies and you are a Superman. You can go out, you can spread. There are people at your home who can be infected. Your mistake can cause someone else. With this note, I would like to end the session of Roundtable from Heartcare Foundation of India under the guidance of Dr. K.K. Agarwal and all the expert meetings. Thank you, Dr. Sunila Garg. Thank you, Dr. Rai. Thank you, Dr. Joshi. Thank you, Dr. Alex. Thank you, Dr. Arun. Thank you, Dr. Ankita, and all other people who have joined here. With this note, I would like to end this session. See you next week, same time, same day.